Hi, my name is Lauren Perlman. I'm a respiratory care practitioner here at Children's Hospital Boston. And today I'd like to talk to you about your child and respiratory support in the form of positive pressure, non-invasive support. That could be what we call CPAP, continuous positive airway pressure. Some people refer to it as continuous distending pressure, and BiPAP, which some people say is bi-level support, but it's known really as BiPAP. And the difference between CPAP and BiPAP is that CPAP, when your child breathes with a mask or an interface on their face covering either their nose or their nose and mouth, they will have some pressure added into their breathing system by this machine that's attached to a mask to your child to help them overcome. For example, in the adult world, many people use CPAP for what's talked about as OSA, or obstructive sleep apnea. And we think about perhaps people that are overweight, but in fact, obstructive sleep apnea affects millions and millions of people today, and it is now currently being used for many, many infants and children and young adults for a variety of reasons. Perhaps your child was born with some kind of an upper airway abnormality that requires a little bit of help so that when they sleep and they breathe, they can overcome the resistance of something in the back of the throat. Now, perhaps they'll have their tonsils removed and it will go away and you won't need it anymore. But it could be something a little bit more serious than that. The CPAP, which is the continuous pressure, one level applied with the interface to the nose or nose and mouth, your child breathes on their own. They take their breaths in and blow them out. We don't push air into them. We just keep a constant pressure throughout the respiratory system with that pressure to help keep the obstruction out of the way of breathing. Or perhaps they have a lung problem in which their lungs tend to collapse a little bit in size during sleep. So in many cases, the children that require these types of support will have an overnight sleep study. You may have visited with a sleep physician here at Children's or elsewhere, and there may have been some recommendations based on what was seen during the sleep study. What they look for is the patient's ability to breathe in and out comfortably, maintain oxygen levels in their bloodstream, eliminate carbon dioxide levels. They also look for, in those formal studies, for sleep efficiency and are they trying to take a breath and not getting air because something's blocking them in this upper region before the air gets to their lungs. So do speak with your practitioner about why they're ordering this therapy for your individual infant or child or adolescent. BiPAP, which includes CPAP, a baseline pressure between the breathing cycles at the end of the breath, also includes an inhale pressure or an inspiratory pressure that will be achieved during the patient's inhale effort. So your child breathes in with this mask on, their nose or nose and mouth, and we'll talk about that later. They breathe in and the machine turns on and assists their breathing to help them gain perhaps a larger breath than they would take during sleep. I keep mentioning sleep because in most cases, children and adults wear these types of supports when they're sleeping, because when we sleep, we tend to breathe a little bit more shallow than when we're awake. And if we have a lung or airway problem when we're awake, we may be able to overcome the breathing difficulties, but when we sleep, we might breathe more shallow. So for that reason, it may be ordered just at night. Now, perhaps your child has a muscle problem with breathing. Maybe they need to wear it during the day as well. People use non-invasive ventilation 24 hours a day, 7 days a week with a mask on their face. You might say that would be probably a little bit uncomfortable, but for some people, that's their choice to have it done that way. So for the purpose of today's talk, I want to introduce you to some of the various interfaces or masks that can be used for the infants and children and adolescents that we see here at Boston Children's Hospital, and talk about some of the nuances of doing this, because obviously when you look at my my little guy here, you think to yourself, oh, that doesn't look so good, and I really can't imagine my child sleeping with that overnight and not pulling it off. And certainly with the younger children and infants, it is a challenge. And your practitioners know that. We do work together with our families to try to see how to make this work best for the children if they do require this type of support. It is possible that the insurance companies, be it the state-funded insurance or your private insurance, may be able to provide some nurses at home at night to help you keep this on your child. Again, you would discuss that with the case manager from the insurance companies or Mass Health and those that are helping you when you're in the hospital before you're discharged home. What we see here is my little guy actually has a total face mask on, and kind of very interesting, it covers the nose and the mouth and the eyes. And you might say, wow, that's really interesting. But what happens is a lot of the interfaces that I have here that I'll show you more closely later put pressure on the bridge of the nose. And that's a very common area to have a pressure sore while wearing these devices overnight. And we do have products, skin barrier products. There are many brands out there. We have, a favorite today at Children's, but it may change tomorrow, so please do speak with your own practitioners about a skin barrier product for your child that you could use under the mask to protect areas of the nose and face that are irritated by wearing the mask. We do recommend, if possible, to have more than one type of mask so that you can alternate. For children that need the nose and mouth covered, because merely giving the support, whether it's CPAP or BiPAP, to just the nose, their mouth opens at night and they leak all of the pressure in the air out their mouth. And you can see how that would happen. If your child awakens in the morning and they have a lot of dried saliva on their mouth, probably a lot of the air is coming out the mouth as well. If the child was evaluated by the sleep doctors and during their sleep study or when they were in the hospital, and the nose mask was adequate to correct your child's problem with breathing and the reason why they needed this support, then that's absolutely fine. You will just have to, wipe their mouth in the morning. We always try to use just a nose mask if we can. So think about what goes in your mouth. Food goes in your mouth, goes down to your stomach. So when I'm inflating and deflating air into your lungs by covering your whole nose and mouth, then it makes sense that you might get air in your belly too. So some people wake up in the morning and have excessive burping. Some children have the gastrostomy tube, and sometimes it can be vented at night, but not everybody has a feeding tube in their stomach, so that isn't always the way to get air out. So there are considerations for using this type of support that encompass more than just the face and the skin. We've now got the stomach and feeding. Some physicians prefer not to let children be fed by their gastrostomy tube overnight while they're on this positive pressure support, so that then you would be thinking about how to get in the amount of calories your child needs during the day. And that would be something else for you to talk about with your own practitioner. When your child may have a cold or some type of illness, that might also hamper them from digesting and cause potentially another issue with the stomach and air. If your child were to have a lot of problems with reflux and throwing up, we highly recommend that we try to use a nasal mask only, because if the child throws up into the mask, what's going to happen to their contents of their stomach? It may go into their lungs, aspiration into the lungs, and that would be certainly a situation that we would not want you to encounter. So there are many considerations. This mask is very helpful to protect the skin, and it's a great mask to alternate from this to a mask, for example, that goes over nose and mouth only. So this one goes over nose and mouth only. Obviously this is an adult size, much larger. I'm not sure I mentioned to you yet that the majority of non-invasive interfaces currently on the market are made for the adult population. But as you can see with this little mask and some of what I've got here, the companies are hearing our cries and starting to develop more and more interfaces, meaning masks of some sort for infants and children and young adults. The adult world, you can use your computer and search, and you will see many, many different companies making many varieties of masks. There are kiosks at the local malls these days where you can look for interfaces if you wear CPAP or BiPAP. But when it comes to infants and children, we have a limited supply. What you see here is one particular type of device that's used to provide what currently this machine is set up for bi-level support, meaning that when the child takes a breath, it helps them inflate the lung and potentially increase the size of the breath, help potentially remove some carbon dioxide, and keep their oxygen saturation to a normal level. Oxygen may also be ordered and provided to your child through the device. This one, it enters in the rear. This other version of a home device, the oxygen is usually added to the circuitry from your oxygen source. You may have oxygen in the form of liquid, gas, or a concentrator at home, and your doctors will order a range of oxygen in liters per minute that you are to add to your CPAP or BiPAP device to achieve the range of oxygen saturation that's normal for your child. We typically here at Children's do order an oxygen monitor, which you can see my little guy here is wearing on his hand. We typically order the oxygen monitor for the children. It also monitors their heart rate. So if they are having a fever, for example, their heart rate may be higher. If they're having some type of distress with breathing or a tummy ache, their heart rate might go higher. So it does have a high and low heart rate alarm, as well as a low oxygen alarm. And those parameters would be discussed with you. The various interfaces that your children use at home with their BiPAP or CPAP and the devices will be provided to you by your durable medical equipment company. Typically, if your child has a sleep study at Children's, they may send you home with an interface that fit well from there and order the equipment after the fact. If your child's been admitted to the hospital, we have some interfaces here that are used at home. We have others that cannot be used at home. And one important thing to know is that you see a single hose going up to this child's face, and you see a mask fitted on their face. And you might wonder, well, the child gets air in, but how do they blow out? So all of the various interfaces made for the home have some type of venting system. And if you could feel it here, I could show you that there's air coming out of the mask right here. All of these masks have a venting system. This one, it's actually a little bit easier to see. There are 4 holes right here in the top of this. And that allows for flushing of air continuously throughout the breath cycle, so that as the child exhales, carbon dioxide that they're blowing out to get rid of is flushed out through these holes in the mask. Be very careful if you do come into the hospital or to another facility and they use an interface or mask on your child. Make sure before you take that home that it's checked to see that it is compatible for use at home. The interfaces used at home are more costly than some of the disposable items we use here in the hospital, because our use here is very different than the use long-term at home. We may see children in intensive care, in the emergency room, who only require this therapy for 12 or 24 hours. So we supply disposable items that would cost less than the items you may have at home that are all vented. The way we get around it here in the hospital is we have holes in our hose that goes from our machine to the child's mask. So it's vented in the hose up near the face. So be very careful. It's a common problem that we've been finding, people coming in and out. And I know you want to take the mask home because it fit well and it seemed to be the right thing for your child, but please do check with the nurses or respiratory therapists on your floor before you leave to make sure that you can take it home. So we're looking at these 2 devices here now. This is one that we're seeing on BiPAP support, and you can see that this child's getting pressure up to 15 and down to 5, up to 15 and down to 5. So I would call this IPAP of 15 and EPAP of 5. That's the inspiratory pressure and the expiratory pressure. If I just had one pressure here, like the 5, and the patient was breathing in and out on their own, that would be called CPAP, and it would say CPAP here on this device. This device is a little bit more sophisticated than the standard machines used out in the community. This particular device has internal and external battery power, and we'll get into why that might be something that you need for your child. This device is a simple BiPAP and can be CPAP. They would look identical to you, but this is BiPAP, but it could be just CPAP. The front half is actually a humidifier. So I can put my distilled water in here, it will heat it, and it will help moisturize the gas that I breathe. Remember, I'm still breathing through my nose when I use these devices, even if it's nose and mouth. So the air I breathe from the room is getting the same humidification that the air you breathe is getting in your home, because you're using your nose and your structures inside your nose and throat to bring your air that goes to your lungs up to 98.6 degrees, fully saturated with water vapor. You know, perhaps your child has cystic fibrosis and they have very thick secretions, something that they're known to have. Then you may require the humidification system for your child to help even further heat and moisturize the air. So adults that tell us they wear these masks and we turn the heat on don't really like the heat and they want it turned off. They don't like hot air in their face. So if you've got a young child or infant using these devices and you turn the heat on because you think humidifying the air might be important, if they're irritable, try turning it off and just see if that's a factor in discomfort. Obviously, strapping a mask on anyone's face is not going to be a comfortable thing, but believe it or not, sometimes it's just within the ability of the child to realize that they can't sleep well without it, or they can't breathe well without it, and with it on, they can breathe, and they will take to it, and you wouldn't think they normally would. This machine requires an additional humidification system, so the air would have to come out of the machine, go to a separate humidification system, and then to the mask. When I talked a little bit about battery power, this one has alarms to tell us if the power goes out in your home. This one will actually automatically change over to internal power and tell us the power went out in the home. This will not. Why is that important? Well, as you might imagine, this one costs about 10 times as much as this one. So your insurance company may or may not easily cover a more expensive device unless your practitioner can write the appropriate paperwork to support that your child needs either an alarm to tell you that the power went out in the house, or that they actually need battery power, because if the power went out and you were alerted to it, as some of these type machines can do, your child cannot go without it for the second half of the night if the power went out at 2 in the morning. So those are things that we're trying to evaluate now with children when we order these CPAP and BiPAP therapies for infants and children and young adults. So can your child take the mask off if the power fails in the home? Or do you need to take the mask off for them? In which case, it would be important that the machine continue to blow air while the power is out in your home. There are obviously many options. Some people put generators in their home if it's a home that they own. Other people will go to some of the local technology stores. There are many devices that you can plug in between a machine and your wall plug to let you know if the power went out in your home. Some flash lights, some make noises. So think about that if you're watching this and you already have these devices in your home and you never thought about the fact that if the power goes out, your child won't be getting this air anymore. I'd like to talk to you a little bit about actually putting these interfaces or masks onto the child. What you'll notice is that in the CPAP or BiPAP mode with these different devices, what comes out of the hose is a lot of air, and I'm going to show you that right now. So this is on CPAP, and when I turn the machine on, there's a lot of air blowing. When I cover it, it slows down. I think you heard a difference in the noise too, but so open, there's a lot of air blowing. And if you approach a child's face with that, they're going to become upset. So some people will put the interface or the mask on the child without the machine attached. Obviously, we're only going to do that for a short period of time. This is one of the smaller masks that are available now, and you'll see that this can fit over the child's nose, not going into the eyes. That's what you'd like for a nice fit, so that it covers the area above the lip and between the nose and fits between the eyes. Some of the masks can be changed in shape quite a bit to fit and bend around, and others do not. So what you'll want to do is secure the mask on the child's face and then turn the machine on, and the flow won't be blowing at them in a very, very high flow rate and discomfort way. There are features on the machines called ramp, and so you can enable the ramp feature so that if your child, for example, was on CPAP or the continuous descending pressure of, say, 8, for example, centimeters of water, the machine can start at 4, and you can pick a time frame, 5, 10, 15, 20 minutes, for the machine to reach the full pressure. So in some cases, the children are more comfortable on the mask with lower pressure, falling asleep, and then will ramp up to the full pressure after 10 or 20 minutes, whatever you set. Obviously, you'll be talking to your individual practitioners about whether your child can use the ramp feature, and it would be just merely a touch of a button onto the machine. So we have humidification and heat that are potentially optional, and the ramp feature, which is something that you might be able to add that might help with comfort while you're applying this. If you're going to put skin barriers on, you'd want to put them on the skin prior to putting the mask on. I caution you that if you're going to put skin barriers on, if you don't put them all the way around on the face, it may raise the mask in one area and not another. So just use caution that the fit is correct once you apply the mask. You want to apply the mask so that the only air you feel coming out around the mask is from the actual port that is made to vent the carbon dioxide out and flush the bad air out of the mask. So as we talked about earlier, each mask has a different way. This one has a million little holes around here. So when you put it on, you'll feel the air there. Each mask is different. Currently, in the United States, we have these two masks as our smallest choices for nose-only masks. This manufacturer makes a larger version, and in some cases, we put this over infants' nose and mouth, as you see here. So we have a couple of different options if we need to cover the nose and mouth for infants. We use nasal masks over the nose and mouth. If this child started to get irritation on the skin, we would then again go to the total face mask and give the child a little bit of time for healing here. So when I talked about earlier alternating interfaces, it's very helpful if you have a couple different options so that if there is skin irritation, you can alternate nights or weeks, whatever works best. For children that are on these devices during the night, typically coming off during the day is enough to help the skin so that there aren't pressure sores. If it's during an illness time, when your child's wearing it all the time, 24 hours a day for, say, a 5-day period because they've been ill, you can expect that there will obviously be more skin irritation from wearing the mask. There will be considerations for how they can be fed during that type of an illness as well. So just to review, we've talked about different devices that are out there, some with battery backup, some with alarms for home power failure, some without, some with integrated humidification systems, easy to use, others with humidification systems in which it's a separate device, and you obviously wouldn't travel with that. You'd have to take that separately because you wouldn't want water sloshing. If the infant or child or adolescent needed to use this support while in the car, for example, for sleeping, you would need a way of powering it while you were in the car. If they needed to use it during the day, all of the time perhaps, obviously you would need some battery power for that as well. And think about a way in which you would provide air if the machine didn't work out well for you and it powered down for some reason. So always think about what you would do if the machine were not to work, whether it's day or night, and come up with a backup plan and a safety plan for your child. Typically, children that are on non-invasive ventilation, CPAP or BiPAP, 24 hours a day. The DME, or Durable Medical Equipment Company, will provide you with 2 devices, a primary and a backup. When it's just for nighttime use or night and nap, then you'll have 1 machine at your home, and the company will come and replace it if you feel it's not working properly. They have sometimes a 2 to 4 hour window for that. One thing I didn't mention earlier is that some of the children need to have their nose clear of secretions to use the nose mask. If I'm wearing a nose mask to give me my, life support, if you will, I need to make sure that my nares are patent and open. Some parents will squirt a few drips of salt water, saline, in the nose and suction it if you have a suction device with a catheter. Others can use bulb suctions, like you can get at your local pharmacy. But you do want to make sure that the nose is not blocked by secretions when you apply the mask for the period of time that the child's going to use it. With regard to the different interfaces that infants, children, and young adults use, another type is what's called the nasal pillow. And this is a device that goes around your head and just slightly into your nares of your nose. That is sometimes found quite comfortable as well. They're obviously a bit larger, so not used in our smaller infants and young children, but probably by the age of 3 or 4, depending on your child's nasal structure, they might be able to use this, and this eliminates the need for there to be pressure on the forehead or on the bridge of the nose. And that goes along with our thoughts of having more than one interface that could suffice for the child to use the CPAP or the BiPAP to try to help it be more skin friendly. So someone that uses a nose mask, for example, over their nose and pressing on the forehead may choose to use the nasal pillow some of the time. This certainly would be comfortable perhaps during the day, maybe while working at the computer, watching some TV. This allows you to eat. If you're able to eat by mouth, you've got your CPAP or BiPAP support in your nose, and it leaves your mouth free to swallow food. We don't advocate swallowing food when you're acutely ill, but certainly for people that use these devices and CPAP or BiPAP, as part of their mainstay of their breathing apparatus, they do eat and swallow and chew food through their mouth. One last thing, some of these masks are designed, if you look at them, they have a soft piece at the bridge of the nose, but the firmer piece is really deep underneath, and then they have a forehead piece that adjusts in depth. And the reason for this is so that you can put some pressure on the forehead and not the bridge of the nose. The bridge of the nose is the one place we see the most skin irritation and breakdown. We cannot let that skin get beyond light pink. If that skin breaks open, it's a huge problem. So please do seek out assistance from your healthcare team if you're noticing redness that is not going away as the mask is off for a little while, or during periods of time when the mask has to be on 24 hours a day during an illness. Please seek out help with another interface that your child can use to eliminate breakdown of their skin. I hope this has been helpful to you, sort of non-invasive ventilation 101 and how do we manage to get through this. Please do work with your social workers, your case managers, your insurance companies to get everything that you feel you need for your children, especially nursing help in the home if your child qualifies, because it's very challenging to keep this on the younger infants, and we do recognize that. We certainly do. We talk about things like papoosing the arms. They have a type of, we call them welcome sleeves, but actually they keep your elbow straight and you're not really welcome to touch anything. Typically used for children that had facial surgery, and they're not recommended for long-term use because it's not good for your arms to not be able to bend. Pins are not typically recommended because they can become undone and, cause the child to have an injury. So think about different ways in which you can teach your child to get used to this device and getting used to having a mask on the face. Thank you very much.